Now the recording is in progress, and so we will start today's lecture. And I'll mute your mic, and like if I ask then any question, and or you have to ask any question, then you can unmute your mic, and then you can ask the question. Mute. The motion asked to. So I have muted your mic, and if I ask any question, then please unmute your mic, or if you have to ask any question, then you can unmute your mic and ask the question. So what we have to do today is we are the unit is health and social care context and principles, and this is the learning outcome 2, which is understand adult social care policy and regulation within a national context. So we have few things in that, like important things in to cover in that unit. Like they are asking us for the adult social care policies. So the policies are important, regulation is important, and the national context. So as we are in the United Kingdom, so we will discuss the national context of United Kingdom. If someone is from abroad, then they will use their national context according to that. But I believe because the qualification is from the United Kingdom, so we all have to discuss about the United Kingdom. And we will be discussing the context and principles of health and social care, and focusing on understanding adult social care policy and regulation within a national context. So we have some national policies and framework. These set the standard for adult social care and outline the government's vision for care and support services. Then we have regulatory bodies. The regulatory bodies like the Care Quality Commission, CQC in the UK, ensure that the care service meet quality and safety standard. Then we have few of the legislation in the health and social care context. For example, we have Health and Care Act 2022. We have Care Act 2014, which provide the legal framework for adult social care, outlining the rights and responsibilities of all the parties involved. And we always have a local authority in the United Kingdom, and they have their responsibilities as well, like local authorities assess the individual need and ensure that the local services meet national standards. So we all have to follow the national standards as well. Then effective care is like very important, and integration and collaboration, like the teamwork, multidisciplinary team, interdisciplinary team, they all work together for the betterment of the service user. And always, whenever we talk about effective care, so it always requires coordination between health, for example, GP, housing, social services to provide service to the service user. They all work together. So now, as an example of a national policy or framework related to adult social work is Care Act 2014. We can say that, and there are others as well, like Health and Care Act. And if we say that, why is regulation and oversight important in adult social care? So regulation ensures that the care service meet quality and safety standard, protecting individuals from harm and ensuring they receive appropriate care. And if we talk about the role of local authorities, so what role the local authorities play? Local authorities assess the need, arrange services, and ensure that the local care meets the national standards. So now what is important in that these principles are important for ensuring the well-being and protection of vulnerable adults in our society. So again, and if you have any question, then please feel free to ask me. Oh, what is the next slide? Okay, now we have here learning outcome 2, the indicative content. So this content is necessary for the students to understand, and national policy for adult social care, including national policy, should be within last 3 years and cover different income, mental health, disability, equality, and uh, right. Okay. So in that we can say that there are some policies which address funding for care, and policies addressing funding for care, and the individual personal income. These are very important. For example, the introduction of the adult social care in England allows local authorities to raise additional fund for adult social care through council tax, and this is like the council does sometime. And we have the mental health and disabilities. The policies like Mental Health Act and the Equality Act in the United Kingdom aim to protect and support individuals with mental health issues and disabilities. And what they do is they ensure that they have the service user have the access to appropriate care services. And we have then in those important bits, we have quality and provision of uh, uh, of adult care, like the Care Act 2014 is like highlight the importance of care and support and to every individual. Then few of the other policies are also from the point of from a worker in the health and social care industry, that minimum wage levels and restrictions on work visas, and these are the points, and the training of the staff, quality of care, these they consider, and regulation of care. And the government has some responsibilities, including like regulating the roles, functions in adult social care to ensure safety and quality standards are met. So these are the important points. So uh, if we say that what would be the impact of financial impact, so funding policies directly affect the financial sustainability of care providers, and the staffing impact is policies related to wages and visas influencing staff levels and the responsibility and the ability to recruit qualified personnel. And there are some mandatory qualification and training which every health and social care uh, caregiver or the staff they are working with, uh, they have to like follow these. And every individual should be trained, and they should have done the mandatory qualification and training, ensuring staff are properly trained and qualified to provide care. And then inspection as well, inspection of adult care setting, regular inspection by bodies like the Care Quality Commission to maintain their standard is important. And these are the important bits for that. And uh, so, and if we understand the interplay between policy, regulation, and the practical aspects of adult social care is crucial for ensuring the well-being of vulnerable adults. And this is it with slide 3, standards in the UK Care Quality Commission, NHS Improvement Journal, Medical Council. Right. So we have few of the important bits here which we need to discuss. Like for example, Care Quality Commission, CQC. We always discuss about that. What is CQC? CQC is the Independent Regulator of Health and Adult Care. in England. It ensures that the care services provided by the hospital, care home, and home care agencies that they should meet the government standard of quality and safety. If you go to the website of CQC, then there we find the grading, grade A, B, C, like that, for any care home or hospitals, even the GP services, everything they provide the grading as well, so we can check the grading. If you go to the website of CQC, there you can type the specific care home name or anything, then you can find out what's the the rating is for that specific uh, service provider. So uh, we have like NHS. NHS is like always there in health and social care in England. So the NHS also need improvement. So while its primary focus is on healthcare services, NHS improvement also works to improve the quality of care in the NHS, which includes aspects of adult social care as well. Is there any question from anyone?
No.
No, okay. So, right. Then we have the next point is General Medical Council, GMC. This is again an important regulator. What does GMC do? The GMC regulates doctors in the UK and ensuring that they meet the necessary standards for medical education and practice, which indirectly impacts the quality of care in adult social care setting. Then we have uh, what other thing we have? Changing care quality skills for health institute for excellence. Okay, so now inspection, as I said, that the CQC conduct inspection of adult social care services and uh, like they assess them on set 5 key questions, like are they safe, effective, caring, responsive to people needs, and well lead. These are few of the criteria which they check. And like we have the NICE. They have mentioned here the NICE. So what is NICE? NICE is National Institute for Health and Care Excellence, and which provides evidence-based guidance and advice to improve health and social care, including adult social care. And then we have skills for health and skills for care, and like both organizations offer workforce development tools and resources to ensure that the adult social care workforce has the necessary skills and training. Then, if you talk about Social Care Institute for Excellence, so it provides guidance and resources and training to improve quality of adult social care. So this is all about it. And service delivery, service delivery and funding. Service delivery and funding like is a analyze the model of care delivery in place such as home-based care, residential care, or integrated care system, assess how these models align with national policies and the needs of care recipients. This is also important. So is it about nice we covered, and what we have next? Oh, there's nothing in that key terminology. Then video. Okay, there is no video. Then we are on the slide 6, and in the slide 6, what they are asking is we need to analyze adult social care policy and regulation in the chosen national context. Again, we will go through with the United Kingdom and like analyzing adult social care policy and regulation within a national context is again very important. So we'll go through with the United Kingdom one. and we need to identify key legislation and examining the main legislative act that provide the legal framework for adult social care. And this may include laws that define the rights and responsibilities of care recipients, care providers, and local authorities. And then if we analyze the regulatory bodies, then the role and responsibilities we talked earlier. And again, for example, we can include CQC in that. And there is a compliance mechanism as well. Uh, and we need to look with regulation is monitored and enforced. We need to consider the process for inspection, reporting, and addressing known compliance matters. Then I said about funding. Funding is also very important. And then the workforce policies, these are important in that. So we need to examine the policies related to the recruitment, training, and retention of the adult social care workforce. And we need to consider how these policies support the development of a skill and sustainable workforce. So we all do the trainings, mandatory trainings and CPD trainings, and also there are other mandatory training which every staff member of the care home or anyone who is involved in the health and social care industry, they must have to do that. So by doing that, we evaluate the quality standard. And there are some uh, challenges always in any workplace. So we also like identify challenges, and it's both the responsibility of the employee and the employer. We always identify for the challenges in the adult social care system. And even if it's not for United Kingdom, so in any country, we follow these. And future direction. So, there could be some potential future developments in adult health and social care. And like in the United Kingdom, they monitor and they update and the policies and the regulation. So in other countries as well, they do that. Plus technological advancement. There are actually many technological advancement these days. Like previously, we always used to fill out the forms, and we always do everything manually and in the form of paper format written by hand. But now most of the things are electronically done, and they are secured in cloud or any encrypted site. We save everything. So now the technology has advanced. So same thing will happen with the health and social care industry as well. So now in the next slide, we have assessment of regulatory frameworks. Okay, so for the assessment of regulatory framework, uh, we need to identify key legislation. Again, we discuss about, for example, uh, Care Act. We discuss about Health and Care Act. We discuss about Equality Act. So what is the main reason for that? Review the primary laws that govern adult social care in the chosen national context. And for example, we gave example of United Kingdom. So we mentioned few of the uh, legislation related with the United Kingdom. And these law, what they do is they typically outline the rights of service user, the responsibilities of care providers, and the role of regulatory bodies. Then we need to look into the guidelines issued by regulatory bodies or government agencies. These guidelines often provide detailed instruction on how to comply with legal requirements and delivery of high quality care. For example, CQC and GMC, they provide the guidelines, and we need to follow them. And standard quality review. So always like the standards set by regulatory bodies, they review the quality standard of the care services provided by care home or anyone in the uh, health and social care industry. So what are the uh, like overseeing care provision? So analyze how regulatory body oversees the provision of adult social care services, and this again include the monitoring, service delivery, investigating complaints, and ensuring adherence to legal and ethical standards. So always like they always try to promote compliance, and how regulatory bodies promote compliance with legal requirement, and this may involve providing guidance, offering training, and supporting continuous improvement efforts. Then we have such the important of adult social care policy and service provider, statutory, voluntary, private, and informal sector, financial implication. Right. Okay. As we have discussed that before, in the previous lecture, we discussed about the statutory, voluntary, private, and informal sectors, and we need to consider how they follow the regulatory requirements, and also how they influence the organizational structure, governance, arrangement, and operational practices. And the financial bit is again very important. So because without finance, no one can work. Even the employees, the employer, everyone needs money. So this is again really important factor. And this is about it. And what we have next is they're asking us for the impact of organization structure and practices. So regulatory requirements can influence the way organizations are structured and how they operate. For example, a government arrangements must ensure compliance with legal standards, and operational practices must align with care quality guidelines. The financial implements, like investing in staff, training, and development, is essential to meet quality standard. So for example, if someone asked that how might regulatory requirements impact the operational practices or of a private care home. So again, private care home is privately funded. They may need to implement specific care planning processes, staff training programs, and quality assurance measure to meet regulatory standards. So because private funded is provided, the funds are provided by the service user, and sometime part of it is provided by the local authority. It depends upon the assessment, because the local authority do the assessment of the people, and then if they are eligible, then they give them some sort of financial support. And the impact of policies and regulation on service provider is crucial for ensuring the delivery of high quality adult social care. And this is important with that. And then we have the slide number 9, is asking for the consideration of key policy issues. So in that, one of the most pressing challenge, sorry, I cannot hear you properly. Your voice is breaking up. Hello. Esther, is you asking any question for me? No. I think you're talking to someone else. I'll mute your mic. And now with the slide number 9. Um, we were talking about the challenges like funding. There could be uh, mm, challenge also in the workforce shortage and demographic changes and aging population and increasing life expectancy are leading to a rise in the number of older adults requiring care. So that's why there are many visa uh, like changes in the visa policies. The United Kingdom is taking immigrants for the healthcare purpose, and this is due to the shortage of health and social care providers, and due to the aging population because they need the help and support. um, then we always need to check for the evolving care needs is for the individual as well, and generally in the country specific context we always evolve care needs and we always look for that. Then we always need to make balance between uh, institutional and community-based center. And there is an always debate going on about the emphasis of institutional care, such as care home, versus the community-based care, such as home care services and things like that. But mostly, both of them are very important. So sometimes we go to the client or the service user home and give them services. It depends and what sort of disability or vulnerability the service user has, and we make the care plan and the assessment based on the assessment which have been done by the private organization or the local authority. So this is with that, and yes. Now we have uh, comparison with international practices. Okay, so like we are in United Kingdom, so we need to do the comparison with the international practices as well. And for example, if we talk about uh, some of the laws like the Human Rights Act 1998. So that is an international law, and we all of us we practice the Human Rights Act 1998 as well. It's an international law, but we always follow in the United Kingdom as well, and the other countries also follow that Human Rights Act 1998. Human Rights Act will remain same for everyone, no matter which international country we are living in. And always we look for the innovative approaches, and we need to look for examples from countries known for their adult social care model. For example, Netherlands has a well-ordered, well-regarded system that emphasizes home-based care and community support. So mostly they do the home-based support and community support in Netherlands. And we need to identify best practices from around the world, such as the use of technology in care delivery, like for example in Japan, or the integrated care model in Sweden. So Japan and Sweden, these are examples in the use of technology and integrated care system model. And we need to consider how cross-national learning and collaboration can help address common challenges such as aging population and evolving care needs. Then what could be the implication for service user? So service user, access to care services. Then the how the policies and regulation impact service user access to care, including the availability of service and eligibility criteria. Then we need to consider how quality standards and regulatory frameworks ensure the provision of high quality care that meets the need of service user. Then we always need to protect the rights and interest of service user. So how policies protect the rights and interest of service user, including safeguarding measures and compliant mechanism. This is important. We always follow the whistleblowing policy. Uh, we always follow the like if there's any harm or anything like that, we always follow the safeguarding policy. We contact the safeguarding lead and or our manager, any senior staff person. So then promotion of empowerment. So we have policies which promote dignity and empowerment, particularly for marginalized or vulnerable group. So like for example, in United Kingdom, we have many nationalities people living in here, and a few of them are marginalized, and they think that they are marginalized, or they have very low number of like residents in the country. So we need to think about their um, culture, lifestyle, and how we can support them according to their needs and requirements. Then this is the conclusion. So in the conclusion, by systematically analyzing adult social care policy and regulating within a national context, the stakeholders can gain insight into the strength, weakness, and areas for improvement within the sector. So we did that. We discussed about the pros and cons. We discussed about the weaknesses and the strength. And then what we have is the 2.2, which is the assess the impact of policy and regulation on providers of adult social care. So, okay, in that we need to again identify the main policies and regulation, and also we need to look at the policies and regulation that govern adult social care in the chosen country, that include law, guidelines, and standard that providers must adhere to. And then we need to also understand the objectives and requirements of these policies and regulation. And we need to look for how they aim to ensure quality, safety, and accessibility of care services. Then we have the financial impact. So uh, we always need to consider the cost associated with regulatory compliance, such as registration fees, inspection preparation, and staff training. And we need to consider how these costs affect the financial sustainability of care providers. Um, and we always need to evaluate the impact of funding mechanism on providers, including reimbursement rate and eligibility criteria for funding. And we need to analyze how changes in funding policies can influence the provision of care services. Then operational compliance. Okay. Now we have the operational compliance, and we need to assess the operational burden placed on providers by regulatory requirements and administrative procedures, evaluation of impact of regulatory complex and bureaucracy, identify opportunities. Right. Okay. So for the operational compliance, we can say that we need to evaluate the time, resources, and effort required for providers to meet regulatory standards. And we need to consider the complexity of compliance procedures, the frequency of updates to regulation, uh, and the challenges of staying current, because we always need to evolve, we always need to follow the current procedures and always like imply with the technological aspects as well. Staff training and everything would be important. And now the impact of paperwork and administrative procedures and operational efficiency, consider the extent to which documentation requirements and reporting obligation consume staff time and resources. So as I said earlier, that now most of the things we do electronically. Previously we used to do everything manually, and now we follow the technology, so this also impact. And we need to examine how regulatory complexity and bureaucracy affect providers' ability to deliver person-centered care, because we always work as a person-centered care for every individual. So we need to consider whether regulatory requirements constrain flexibility in responding to individual needs. So, but we always follow the individual needs of the person. So the care plan, whatever we make, is based on the individual basis, and is with the person-centered care plan we make. And we need to assess whether regulatory constraints hinder providers' ability to implement new approaches, technologies, or care model that could improve outcome of services. Then, uh, like uh, we have the opportunities to streamline regulatory process, and we need to identify areas where regulatory process could be simplified. Why we do that is to reduce the administrative burden on providers, consider the potential for consolidating requirements, simplifying reporting mechanism, or adopting digital solutions, which we all are doing in the United Kingdom. And always we look for the opportunities to promote greater flexibility and autonomy for the provider and as well as for the service user. We always try to balance regulatory requirements with service quality. And if we say that how can regulatory bodies reduce the administrative burden on care providers without compromising on quality and safety, because this is important. What they can do is they can streamline process, provide clear guidance, adopt digital solution, and focus on outcomes rather than excessive documentation. So we all know that now we use the laptop, the pads, and we have everything digitally secured on clouds, and these things help us. um Previously, if we were doing it manually, then what we used to do, we used to scan those documents and save it as a PDF or picture format. So these were taking a lot of time. So now time has changed and we have evolved. So now we don't need to scan those documents and things. Now in the next slide, we have uh, quality of care. Okay, quality of care is again really important, not in health and social care field only, everywhere, whether it's teaching, nursing, health and social care, whatever we are doing, even in office work. So quality of care is important. And we as in healthcare, in the healthcare field, we always examine how regulatory standards and inspection help identify areas for improvement. And we always consider how inspection and audits provide feedback to providers on their performance and highlight areas where enhancement are needed. Same thing we do with the students as well. For example, if someone sent us the assignment, then the tutors provide them the formative feedback, and based on the formative feedback, the student change the work according to the feedback and improve the quality of their work. And in the end, when we submit the assignment, after that we get the summative feedback, which is a final version of the feedback. And this is how we give the feedback, and the student improve their quality of work. Same happen with the health and social care industry. And always we evaluate the role of regulation in promoting continuous quality improvement. uh, like we always consider how regulatory requirements encourage providers to adopt best services, innovative, and strive for excellence in care delivery. Then transparency is and accountability in public trust is very important. And always assess the extent to which regulatory oversight increases transparency in care services. We always consider how the publication of inspection report and rating provides valuable information to service user families and public. that's why we always go to the CQC website and check for the grading and or the ratings. We need to okay, then the gaps. Okay, identify gaps and shortcomings in regulatory framework, and uh, like we look for there are variation in how regulation are applied across different providers, and we always look for any gap, and we look for the whether staffing requirements are sufficient to ensure safe and effective care delivery. We consider whether regulatory frameworks provide adequate support for the ongoing education and skill development of care staff. So that's why at any workplace, we always have the CPD or the general training and the mandatory training as well. Then workforce development, right? Mm, for the workforce development, we have to evaluate the impact of policy and regulation on the recruitment, retention, and development of the adult social workforce. Okay, so workforce development. So impact of recruitment, retention, and development. And we always need to examine how regulatory requirements for qualification, training, and registration affect workforce supply. So whether these requirements help ensure a skilled workforce or create barriers to entry. For example, if we are following everything and the care provider is giving proper training and to the staff, so it could be better. And what would be the influence of regulation on the skills, and like we always consider how policies support or hinder the development of a diverse and capable workforce. So sometimes there are for example, for the break, if an organization does not have a policy for the timing of the break which staff took, for example, so sometimes the managers or anyone they have their own opinions and policies in place which is not authorized by the organization or the local authority, or it's not related with the legislation of the country specific context. So we can challenge that, but usually we follow all the procedures and the policies which is by the organization, so which is legally we need to follow. And then effectiveness of workplace initiatives. We need to always evaluate the impact of workplace planning initiatives. And sometimes we have shortages in the care sector. So as I said earlier, that we have a shortage of people in the care sector. And that's why the government is taking initiative effectively to forecast and respond to workforce needs. And we need to see the effectiveness of training programs and professional development opportunities. So now the government is giving funds to eligible people to do the courses related with the health and social care industry. And there could be barriers to workplace participation. And what are those barriers? Like always we need to identify barriers to workplace participation, uh, which include low wages, limited career advancement opportunities, and high level of burnout or job dissatisfaction. So these impact on these barriers impact on the recruitment and retention as well. And the workplace participation will be less due to these uh, barriers. So then we need to explore policy intervention to address workforce challenges. Like we need to consider measures such as wage increase, career development pathways, and initiatives to improve job satisfaction and working conditions. So that then we have innovation and service delivery models. Okay, so we need to analyze the impact of policy and regulation on the adoption of innovative practices. Uh, Role of policy incentives, identifying barriers. Okay, few of the bits we discuss as well. And now, we always examine how regulatory framework influence the adoption of innovative practices. So, like whether regulation provide the necessary flexibility for experimentation and adaptation to changing needs and preferences. And we look for the impact of policy and regulation on the development and implementation of alternative service delivery models such as community-based care, integrated health and social care services, and technology-enabled care. We can name few of them. Then we always look for the role of policy incentives and what they do in promoting person-centered care. And we look for the funding mechanism and other initiatives which support the implementation of care models. And we always look for the individual needs and preferences. Then we always consider how regulatory framework accommodate collaboration between different care providers and sectors to deliver seamless and coordinated care. um, then we can look for the barriers to innovation in the adult care sectors. So in the adult care, such as risk aversion among provider, regulatory barriers that limit flexibility and funding, uh, and sometimes it has a huge impact. And Mm, we have to explore policy levels that can overcome these obstacles. We take measures such as regulatory sandboxing, allowing for controlled experimentation, financial incentives for innovation, and support for research and development in care models. This is we do with the innovation and service delivery model. So now we have the conclusion. So by systematically assessing the impact of policy and regulation on providers of adult social care, stakeholders can gain insight into the opportunities, challenge, and trade-offs inherent in regulatory governance. And what this assessment can inform evidence-based policy decision, regulatory reforms, and capacity building initiatives aim at enhancing the quality, accessibility, and sustainability of care provision for adults in need. So, because specifically we are talking about adults, so it mentioned about adults, and we also do the same things with the children as well. But our topic is related with the adult service, so we discuss that. Then is now in the slide they are asking to evaluate how successful policy is in meeting national care needs for the adult social care sector. So right now, if we review the objective of national policies related to adult social care, we always consider whether these objectives address the key needs and challenges facing the sector, such as access to care, quality of services, workforce development, and funding sustainability. And we always evaluate the alignment of policy objectives with the broader goals of the healthcare and social service system, such as promoting public health, ensuring equality, equity, and supporting vulnerable population. We always look for that. Then, what could be the implementation of these strategies? It could be like the effectiveness of these strategies in translating policy goals into actionable plans and program, and uh, coordination and collaboration, like the multidisciplinary team and different agencies, like among various stakeholders involved in policy implementation, including government agencies, care provider, and community organization. They all work together. And what we can also say that is how well the policies have met the identified care needs, improve access to service, and enhance care quality and address workforce challenges. And we look for the uh, look for indicators such as service user, staff satisfaction, care accessibility, staff retention rate, and health outcomes. And uh, this is all about like that. And if we talk about the gaps, so policymaker can address gaps by conducting regular needs assessment, reviewing policies based on feedback and evidence, and sometimes increasing funding and resources and fostering collaboration across different sectors. Then we have clarity of policy objectives. Okay, so uh, always like we evaluate the clarity of policy objectives. We consider whether the goals are clearly articulated, specific, and measurable. This help in understanding what the policies aim to achieve and how success will be evaluated. And uh, right, we follow these, and then we have to consider whether the objectives are realistic and given the available resources, time frame, and constraint within the sector. So we make the chart as well, and then in that we always follow the like are the goals measurable, achievable. So we do that. Then we have to consider how well the policies reflect the needs and expectation of service user, also providers and policymaker. Then stakeholder involvement in policy development. This is important as well, and whether stakeholders have been consulted and engaged in shaping policy objective, which can enhance relevance um, and could help the service user and the service providers. Then, uh, for example, policy objective, uh, like the policy objective address key challenges within the adult social care sector, such as demographic challenges, raising demand for care services, and workforce shortages. We need to evaluate whether the policies are responsive to these challenges and designed to address them effectively. Uh, Financial sustainability is always very important. Then we emphasize on the innovation and improvement, and we need to consider whether the policies encourage the adoption of like new technologies and practice, and like we always go for the continuous quality improvement in care delivery. This is about this slide. Then we have the slide which is effectiveness of implementation strategies. Okay, so we need to check the implementation effectiveness of strategies which are implicated, and right. So, for example, we can say that if we have various program and initiatives, are they well aligned and like uh, are they working to achieve the policy objectives, and are they providing the help or the support which is required for the betterment of the service user or not? Then we can say that implementation strategies across different level of government and within different organization, we always consider whether there are disparities or inconsistent that could impact the effectiveness of policy implementation. Then we look for the coordination among stakeholder, in which including government agencies, local authorities, and care providers, and how well these groups work together to implement policy initiatives and address challenges uh, collectively. Then we can look for the role of partnership and collaboration, uh, like uh, uh, we always like evaluate the how partnership between government care provider and other stakeholder contribute to achieve policy goals. And we discuss about the stakeholders, and there are again some challenges and solution. And what we need to do is identify challenges faced in implementing policy initiative, such as resources and resistance to change or gaps in communication and coordination. We always explore for the solution to overcome implementation challenges. We always follow and we always look for the strategies to enhancing collaboration and improving communication and ensuring like the resources are effectively implicated. Then outcomes achieved. Okay, so analyze the outcome achieved as a result of policy intervention in meeting national care needs for the adult social care sector. Okay, so for that we can say that uh, we always um, evaluate short-term outcomes such as immediate improvements in access to care services, enhancement in care quality, and initial impact on service user health and well-being. And we also look for the long-term outcomes, which include sustained access to care, long-term improvements in quality of care, ongoing health and well-being um, outcomes for service user, and the sustainability of service provision. Then measuring outcomes across multiple dimensions, so that involve assess challenges in the availability and accessibility of care services for different population group, including marginalized or undeserved communities. Then the care of quality, so we always look for the improvements in care quality and health and well-being. We always look for the impact of policy intervention on the physical, mental, and social well-being of service user. And we always try to use a holistic approach, which involves physical, mental, emotional, and spiritual health as well. So then the sustainability of service provision, we evaluate the financial sustainability of care services and the long-term valuability of care delivery models. Then the data. This is important in research as well as in that learning outcome too as well. So as it is mentioned that quantitative and qualitative data. So we use the quantitative data such as stats or service access, quality metrics, health outcome, and financial indicators to measure progress towards policy goals. And this is the quantitative data. So quantitative data is related with numbers, related with the quantity. Then we have the uh, qualitative data from service user feedback, provider experience, and evaluation studies to gain insight into the effectiveness of policy intervention. So what we do in that in qualitative data, we write the qualities like it's in written format, more written format, rather than using the stats or numerical data. Then we always look to monitor progress. So how we do that is through performance indicators that track key aspects of care provision, service quality, and user outcomes. Then what we do is we utilize evaluation studies, and why we do that is to assess the overall impact of policy intervention on the adult social care sector. These studies can provide comprehensive insight into what is working and what is not and why. So these are the important bits and like areas for improvement. So based on evaluation finding and use these insight to inform future policy adjustment and implementation on strategies. This is we do. Then we have equity and accessibility. Right. So In this, what we do is whether policy initiatives specifically target undeserved population, such as low-income individual, ethnic minorities, or people with disabilities, to ensure they have like care provided to them, equitable, and access to care service is available to them. Then what we do is we evaluate the effectiveness of these initiatives and how we do that in reaching and benefiting these population, and whether they have successfully reduced disparities in access to care. Then we address the unmet need. So every mm, place or a postcode maybe in United Kingdom, they have their own unmet needs. It depends upon the area, the geographical area, the age of the population, and few of the things they consider. And we have unmet needs, different unmet needs, local unmet needs. We used to check what are the unmet needs, local or the area wise, and then we work accordingly to improve the situation. And now we always try to reduce the barriers. So in reducing barriers to accessing care, such as financial constraint, geographic isolation, or um, lack of resources or appropriate services, we always uh, look to reduce these barriers. And then we always promote choice, autonomy, and empowerment. And we always look for the mechanism for engaging with diverse communities. And we always look for the effectiveness of mechanism and for engaging with diverse communities, including cultural, linguistic, and other barriers to access. And what we have, sustainability and resilience. So for that, um, right. So we evaluate the sustainability and adequacy of funding arrangements for adult social care, considering factors such as government funding, private contribution, and the impact of economic fluctuation. And we assess the effectiveness of funding mechanism in ensuring the availability of resources for delivering high quality person-centered care services, and their ability to support the sector in the long term. Then workforce planning strategies, these are again really important. So workforce planning strategies are important in addressing current and future workforce needs within the adult health and social care industry. And there are sometimes resilience. We always assess the resilience of workforce planning strategies in adopting to changing demographic, technological innovation, and evolving care needs, and their capacity to sustain a skilled and motivated workforce. Then uh, regulatory framework. For the regulatory framework, we always evaluate the effectiveness of regulatory frameworks in promoting high standards of care, ensuring compliance with regulation, and safeguarding the rights and well-being of service user. Then uh, we always look for the capacity of the sector. So, what it means is to adopt to changing demographic, technological advancement, and evolving care needs, and the effectiveness of policy measures in facilitating adaptation and innovation. So again, it's related with the technological advancement and whatever is required to increase the capacity or make it better. So now we always do the promotion of innovation uh, and value for money as well. Sometimes the what we also do is ability to deliver high quality care services while maximizing efficiency and value for money, and the role of policy in supporting these objectives. Then what we have next, feedback and continuous improvement. So for that, what we always do is stakeholder engagement. So identify key stakeholder involved in or affected by the adult social care policy, including service user, care provider, policymaker, and regulatory bodies. We always identify them and look for the betterment. Then we develop effective communication channels to engage stakeholder in feedback process, such as regular meetings, surveys, focus group, and online platforms to gather their perspective and insight. Then it's related with the feedback mechanism. What we do is we establish formal feedback mechanism to gather input from stakeholders on the strength, weakness, and areas for improvement of policy intervention. We utilize surveys, interviews, and consultation to collect feedback on the impact of policy intervention, and we identify emerging challenges and assess the effectiveness of implementation strategies. Then we conduct regular evaluation exercises. We use performance reviews, impact assessment, and case studies. We uh, use feedback and evaluation finding for evidence-based decision making. Why we do that? To inform evidence-based policy decision and program adaptation. uh, Evidence-based always like is based on the evidence. That's why it's called as evidence-based research or decision making. And then we ensure that policy decisions are informed, and we look for the continuous improvement. We look for the continuous improvement and promote a culture of continuous improvement within the health and social care sector based on the stakeholder feedback and evaluation finding. And we always encourage stakeholder to share best practice. Uh, so this is all about that. And what we achieve is by engaging the stakeholder in ongoing feedback process and evaluation exercises, we can gather valuable insight into strengths, weaknesses, and areas for improvement. Then what we have next is the conclusion. So uh, for the conclusion, by systematically evaluating the success of policy in meeting national care needs for the adult social care sector, and stakeholder can identify strength, weakness, and opportunities for improvement and inform evidence-based policy decision. This is what we discussed earlier. So I'm sorry that I took extra time today. So now we'll conclude today's lecture. And again, I'll request all of you, like, if you have any question, then you can ask me. Is there any question from the students?
Hello.
Hello, yes.
Yeah. Good evening.
Good evening, good evening.
I joined the lecture. Maybe after I later discovered that there was a lecture, so when I joined it, so I don't know where you started. I don't know when you started, so I don't know if there is a record for the lecture that if I can be able to go through it after they concluded one.
Definitely, definitely. For this unit, we are delivering the lecture at 3:30 p.m. United Kingdom time, and 3:30 till 4:30, and the recording will be available on YouTube or like whatever the medium the college use. Like you can contact the management, and what I have heard that the recording must be available to all of the student, and it would be in YouTube, and the slides and everything would be available to the students. So don't worry about it, you will get the recording and the notes and the slides and everything.
Okay. Another thing is that what is the topic of this
The topic of
lecture?
today's lecture is
Yes,
health
or
and
course
social.
code.
uh,
Okay.
the course code is H slash 650 slash 8740, and this is the unit health and social care context and principles. So today we discuss about the learning outcome 2. Yesterday we discussed about the learning outcome 1, and today we discuss about the learning outcome 2, which we call as LO2, and this is to understand adult social care policy and regulation within a national context. So we are in United Kingdom, so we discuss about the national context of United Kingdom. So because maybe some of the students are from other countries, so they are from abroad. So but because this course is regulated and like the degree or the certificate is awarded in the United Kingdom, so we look for the United Kingdom perspective. And
Okay.
for example, in some cases, like if they ask us for international example, then we provide some international examples. I don't know whether you were here that time. I was giving example of Human Rights Act 1998. So because Human Rights Act is not only for United Kingdom, it's like a international legislation which most of the countries or all the countries follow. So it depends like but the learning outcome is says that within a national context, so we follow United Kingdom.
Okay. Thank you very much.
No problem. Any more question from anyone? Please feel free to ask me the question, so I would be more than happy to help and support you, even with any sort of help regarding the assignment or anything. I'll try my best to help you all. So but I don't know what would be the procedure to contact me. You can ask the management for one-on-one session or anything like that if you require any additional support. And like we have other people in the college, and they may be able to help you with the guidelines, how to do the assignment, and how to get the notes and how to do the referencing and thing. But I'll also teach you these bits when time comes, and so don't worry about it. We always follow the Harvard referencing style. So how we do that, and uh, we make the assignment generally on Microsoft Word. Sometime if we have presentation, we use the PowerPoint. So don't worry about these things. If we understand the basic concepts of the lecture, then it would be easier for us to find the information and rewrite them in our own words. Why we do that is to avoid the plagiarism, and we always give reference. We always give the in-text citation to give credit to the original author. So these are the few of the bits which we need to consider always. And that's it for today.
Yeah. Hello.
Yes.
Yeah. Is it the last lecture, or is there any other one apart from this?
No, there would be 4 lectures. This is the second lecture because in every unit we have 4 learning outcomes. So
Okay.
learning outcomes, in short, we call it like in the on the screen you can see that it's written there LO2. So LO means learning outcome, and 2 means this
Yes.
is the
Yes.
second one. So
Okay.
the first one we did it yesterday, and the remaining 2 we will do on the next Saturday. Saturday we will do the learning outcome 3 at
Okay.
same time,
What is the time for the lecture?
3:30 UK time,
3:30.
3:30 p.m.
Okay.
Yes. Then the learning outcome 4 we will do on Sunday. So next week on Saturday, Sunday, we will cover all of the 4 learning outcomes.
The same time. Is it the same time?
Yes, 3:30 till
Okay.
4:30. So today, like it was a lot of slides on this unit, so that's why we took uh, extra minutes. So I'm really sorry for that. I took extra time of you all, but again, these were the important topics. We need to I need to explain to you all that how we work in the health and social care context and principles. So that's
Okay.
why I'm sorry I took extra time today.
Yeah. Thank you very much.
No problem. But honestly, I'm more than happy to help all of you wherever you need my assistance, my help. I will be able to guide you properly, and just ask the management how you can contact me and things. Then I'll try my best.
All right.
Thank
Thank
you.
you so much.
Thank you,
Really
everyone.
appreciate. Yeah.
Thank you, sir. Thank you, everyone. Take care. Bye. See you next week. Take care. Bye.
See you
Bye.
next week.